Hi, this is Lisa. I'm recording your last podcast for medical terminology. This podcast will be prefixes. Before we start, I do want to say that I go over every single quiz you submit for prefixes. When I set the quiz up, I have to guess every single way you're going to answer the question. And sometimes you guys surprise me and put an answer down that I didn't have exactly that way in Canvas. So Canvas marks it wrong. But I go through, and as long as I know you have the right word or the right meaning, I give you the credit back. So you do not need to email me. I promise I go through everybody's and I will correct it. Okay, on to the podcast. So we're going to be talking about prefixes. And prefixes are typically what's at the beginning of a word to modify their meaning. And they're usually pretty specific. So we've learned about abbreviations, we've learned about root words, and we learned about suffixes. So the last thing we need to work on is our prefixes. And that's what's at the beginning of the word to help us understand. Sorry about that. I had a suffix on the page and I've changed it. So we're first going to start with prefixes that deal with size. So if you have an A or an AM, it's without or none. So analgesic is we're wanting them to not have pain. So anal, AN or A is without, gesic, pain, without pain. Micro means small. So microcephaly is a person who has a small head or a small brain. Macro is large. So if you think about the macrophages that are in our body that attack when we have an infection, these are large white blood cells that come to get rid of, basically to eat the infection. They consume the infection. So macro's large. And mega is large. Usually I hear mega like megacolon, where somebody has a really big colon. Their colon is bigger than it should be. So both macro and mega can mean large. Speed, Brady means slow. You have bradycardia, tachy's fast, tachycardia. So both are referring to a heart rate. One is a slow heart rate, one is a high heart rate. And we know it's heart because cardia. So tachy, fast, cardia, heart. Angia is vessel. So angiogram or angioplasty. So angioplasty is where they're going to go in and put a scope in and look at the veins, especially around the heart, to see how they're doing. And then we have veno for vein, and that's venospasm. Venospasm is when the vein is actually spasming, it's contracting. And people can have that when they're having an MI. Hypo is low and hyper is high. I'm not sure what that word's supposed to be there. High or fast, excuse me, it's supposed to be fast. So hypothyroid is where the thyroid is not working the way it should be. Hyperthyroid is where the thyroid is working too high or at too fast of a level. And we've also heard of hypertension, high blood pressure. And when people have low blood pressure, we call them hypotensive. Neuro is nerve. Neurofibromatosis, and that's where the fibers on the nerves or the brain or the spinal cord actually have tumors form. But that means nerve. DYS, difficult, painful, abnormal. Dysphagia, someone has trouble eating, they're not able to eat. Dysmenorrhea, they're having trouble with their periods. Cyst is bladder. So cystotomy is where they actually make an incision into the bladder. So if you know cysto is bladder, and you remember otomy from our suffixes, otomy means to cut. So cystostomy is where they cut into the bladder. Coli is gallbladder. So cholecystitis is an inflammation of the gallbladder. See, it's all coming together now, isn't it? Litho is stone. So when somebody has a kidney stone, they'll go for a lithotripsy. And that's where they're going to pulverize. They're going to use sound waves to pulverize and disintegrate the stone so the patient's able to pass the stones, the crushed stones. Lapra is abdominal wall. So laparotomy is they're going to make an incision into the abdominal wall. And you'll hear this a lot of times. They'll do an exploratory laparotomy where they're going to open up the abdomen and see what they can find. Larynx is the larynx. Laryngitis. So if we remember, itis is an inflammation. So laryngitis is inflammation of the larynx. Trachea refers to your trachea. Trach, I can never say that, trach. So if you think of tracheostomy, where we make a hole into the trachea and it comes out, the stoma is on the outside of the body, and that's where the patient breathes through. Bronch is lungs. So bronchoscopy is where the doctor is going to take a flexible camera and put the tube down in the patient's lungs, and they're actually going to visualize the bronchoscopy, the bronchia. Pneumo is breath, air, or lungs, so like pneumonia, pneumonitis, pneumonectomy. Pneumonia we know is an inflammation of the lungs. Forgot what I was going to say. And then pulmo also means lung. This can be pulmonary, pulmonologist. Pulmonologist is a doctor who specializes in treatment of the lungs. So you can see we're kind of breaking this up by body system. We have pila, which is renal collecting ducts. So pyelonephritis refers to an infection in the kidney itself, in the renal ducts of the kidney. UR is urine, so urinary urologist. I can never say this one. Oligo is scant amount, less than normal. So oligodactyly, oligodactyly, is where they don't have enough fingers. They have few fingers, or maybe the fingers they have are not developed. Myo is muscle, so myocarditis is an infection or inflammation in the heart muscle. So we have myo, which is muscle, card, C-A-R-D, which is cardio, and itis, which is inflammation, myocarditis. Sub means under, so we see this when we give medication sublingually. We'll put the medication under the tongue. Super is not one I see all the time, but superbug is a good example. It's something that's beyond normal, and when we have, it seems like we always have the superbugs in the media, but it's just an infection that's going out of control. Supra means above. A good example of this is supraventricular tachycardia. So supra is above, ventricular is the two of the chambers in the heart. So it's above the ventricles, and we know tachycardia means a fast heart rate. So supraventricular tachycardia is when the patient has an elevated heart rate and the origin is coming from above the ventricles. So the ventricles aren't causing the problem or the abnormal rhythm. It's something happening above them that's triggering this abnormal rhythm. Trans is across, so if you think of transfusion, we're giving blood from one person to another. So it's going across. It's going from outside the body across into the body. Mal is bad or poor. I think of malnutrition. Mal means poor nutrition, so somebody who's not able to eat like they should and get the nutrients they should need. So this is the last of your podcast for medical terminology. What we'll have you do is we'll again have you go to the Quizlet. I have flashcards for you to practice with. There will be a quiz. But can you see, I'm hoping what the purpose of all of this was to help you understand how you can take the words and look at the prefixes, the root words, and the suffixes, and you can know what's going on. And then that way, if you know this, you don't have to always memorize as many things, because you can look at the words and you can understand what they mean from the words that are there. So I hope you've enjoyed this, and I'm going to put this up on Canvas as an ARC video, so you can put questions on the video itself, and I will monitor and follow it, and I can make comments back to you, and we'll see how this works. I want to try this with medical terminology because I think it'll be a good way for us to communicate and to have a conversation about medical terminology. Thanks.